Good evening and thank you for joining us. We begin tonight with the U.S. president's health. Donald Trump has tested positive for COVID-19. So did his wife and several members of his inner circle. Trump is working from his hospital room at Walter Reed Military Medical Center, and tonight he's speaking from the hospital about his condition.
We're going to beat this coronavirus, or whatever you want to call it, and we're going to beat it soundly. So many things have happened. If you look at the therapeutics, which I'm taking right now, some of them, and others are coming out soon that are looking like, frankly, they're miracles. If you want to know the truth, they're miracles.
It's still not clear where and when Trump contracted the virus. But as Jennifer Johnson reports, the focus tonight is on the risks he faces with a disease he's downplayed.
Doctors say U.S. President Donald Trump is doing well at Walter Reed National Military Medical Center while battling COVID-19. His doctor says the president is undergoing a 5-day course of the experimental treatment remdesivir.
At this time, the team and I are extremely happy with the progress the president has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving.
Dr. Connolly painted an optimistic picture contradicting White House Chief of Staff Mark Meadows, who told reporters the president's vitals over the last 24 hours were concerning and the next 48 hours will be critical. Multiple reports say the president needed supplemental oxygen while still at the White House. The president tweeted, "I'm feeling well," but doctors say his age, 74, and being slightly overweight, make him more at risk.
We have monitored his cardiac function, his kidney function, his liver function. All of those are normal.
The president and first lady are among several people who have contracted the virus after attending the ceremony announcing Judge Amy Coney Barrett's nomination to the U.S. Supreme Court. Others include former counselor to the president Kellyanne Conway and Republican Senators Mike Lee and Tom Tillis.
I think the network of people who are possibly infected and carrying this virus are just, it's almost unlimited.
Trump campaign manager Bill Stepien and former New Jersey Governor Chris Christie have also tested positive. They were part of a small team that prepped President Trump for his first debate against Democratic candidate Joe Biden.
I put a mask on, when I think I need it.
In the audience, members of the president's family refused to wear masks, violating an Ohio mandate, but sticking to a common theme for the Trumps and members of his administration throughout the pandemic. Democratic candidate Joe Biden has tested negative so far. COVID-19 now becoming even more of a centerpiece of his campaign.
We need to take the science of fighting this disease seriously if we're going to save lives.
Doctors won't say how long the president will stay in the hospital. Vice President Mike Pence remains virus-free and continues to campaign while the president cannot, adding more chaos to a presidential election just over a month away. Jennifer Johnson, Global News, Washington.
Our Washington Bureau Chief Jackson Proskow is here now to talk about the implications of the campaign with Donald Trump in hospital and exactly 1 month until the election, Jackson.
Robin, there are a few critical things to remember as both campaigns try and press ahead at full speed. One is that voting is already well underway. Millions of Americans have already cast ballots in person or by mail. And number two is the pandemic is the one issue President Trump is desperate to avoid talking about. Now he can't. It is the issue in this campaign. Now, the Trump campaign says the president has obviously suspended all in-person campaigning, but the vice president and 3 of his children are set to hit the campaign trail for in-person events this week. Meanwhile, former Vice President Joe Biden is pressing ahead as close to normal as possible. We should point out he has pulled all of his negative campaign ads from the airwaves out of respect for the president. Really, though, these are critical final days of the campaign, and Robin, they're especially critical for President Trump, who is well behind of Biden in the polls right now.
But what happens if one or both of the candidates becomes too ill to finish the campaign?
Well, this is where the Electoral College, which is often maligned, might actually come into play. And here's a hypothetical for you. If one or more of the candidates somehow becomes incapacitated between now and Election Day, the Electoral College could actually step in and appoint a candidate to be chosen by the electors.
The electors would be instructed by their party national committees to vote for X instead of President Trump, or if something happened to former Vice President Biden, vote for Y instead of Biden. So the electors don't even meet until early December. and then they forward their votes to Congress, and Congress counts them and makes it official in early January. The inauguration is January 20th. So our system draws this out and actually makes it easier to adjust if something terrible happens.
Okay, Jackson, what about the remaining presidential debates? Will they continue?
Yeah, this is the big question in all of this, and it really depends on how President Trump's recovery goes. We know that the Commission on Presidential Debates is also looking at changes for any of the upcoming events, and a big one would be requiring all audience members to keep their face masks on at all times. And this comes after several of Trump's family members refused to wear masks during the last debate. The first vice presidential debate between Kamala Harris and Mike Pence is scheduled for this week. We already know that the two candidates have been moved further apart on stage, but really, Robin, it's a big open-ended question as to if or how any of these events can go forward right now.
Our Washington Bureau Chief Jackson Proskow, thanks for that analysis.